right. Thank you, Roz. Ms. McLean, do we have any public comments that have been submitted for today?
No, sir.
Okay, very good. So board members and those who are in attendance to this meeting, we discussed at the last meeting that this would be an abbreviated meeting. So if you haven't already done so, strap on your seatbelts because we're gonna be moving here today. So, but if you certainly have any comments or any questions, please don't hesitate to ask to be recognized, and we'll take the time to address your questions or concerns. Okay, Director Jenkins, would you like to take the time for any staff or program recognitions at this time?
Be real brief, Mr. Chair, and to this wonderful board, I say good evening to you. I just want to lift up and recognize our public health social workers. This is National Social Work Month, and they tend to get a little less love than nurses and others. But, you know, again, being married to a social worker, I know Social Work Month very well, but they do a lot of good work in public health, from Medicaid case management to, you know, community health work, you name it. So again, I just want to take the time just to recognize our public health social workers.
Thank you, sir.
Thanks for all you do, social workers.
Absolutely.
My sister-in-law is a social worker too.
One of my two that are on spring break right now might end up being a social worker. So yeah, that's good. That's good. Thank you for that recognition, Director Jenkins. Excuse me. So we don't have any administrative reports or presentations. So we'll move on to the public health vacancy report. Hopefully everyone's had an opportunity to look over that. The vacancies look to be fairly stable, or no major changes there that I was able to see. Director Jenkins or anyone else for that matter, would you like to make any comments regarding the vacancy report?
Fairly steady, Mr. Chair and board. You know, I would say we kind of even out. We do have some individuals who have gone on to greener pastures, but as the economy begins to improve and folks decide that they really do want to work, we have been fortunate to hire a lot of nurses and a lot of critical positions. But you know, per your comment earlier, you know, it's pretty steady.
Very good. Yeah, I noticed that still that the resignations tends to be the highest category of vacancy that we have on the report. So like I said, hopefully folks will come back and come back to work and take some of those positions off the vacancy report. All right, we'll move on to the NOV report. Any comments there? I know Attorney Wardell usually gives us a brief update. Attorney Wardell, do you have anything to add today?
No, that's been pretty status quo since the last meeting. We have one case that's working its way through the system, and you know, everything else is actually in pretty good shape. Actually, better than I think our list has been in a long time, to be honest with you.
Mm-hmm.
But we do have that one case that's working its way through the system, and hopefully we can get that resolved. I know it's on for mediation, and we may even have a few hearings before then. But the last I checked, the homeowner had pump and hauled the system, so there wasn't a present violation at this point. But of course, they need to go in and do a lot more than just pump and haul. So it's working its way through the system, and we'll get it resolved. But slowly but surely, we're working through the list and bringing people into compliance. We have a number of non-operator notice of violations, which basically says that these are big systems and they have a requirement of having an operator, a licensed operator. And every 5 years, you have to just file a notice that you have this operator. And, you know, people just don't do it. So it's not an active violation in terms of effluent surfacing on somebody's land, it's more of an administrative problem. So that's we have a lot of those. So I think it's in pretty good shape right now. And I
Okay,
don't
very
usually get
good.
to- So that's good.
Very good. Thank you. Thank you. Does anyone else have any comments or questions? Ms. Smith?
I have a question.
Go ahead.
Um,
Commissioner Lum.
Thank you. Yeah, this is for Attorney Wardell, also other public health staff, if they have any thoughts about this. Somebody reached out to me from the ADA's office. They were sharing a concern, and this kind of is like connected to public health. So I said I would like raise it here if anyone has any expertise or knowledge on it. So, and forgive me because I'm not an expert in this area, so I may say something wrong, but it was like around protective orders and like DSS and wellness cases around children, that there needs to be, if there is a case involving a child, there needs to be like a medical examination of the child in the case of abuse. And so they usually refer the children to Duke Health or Duke Hospital to do the examination. And it's typically the costs are covered or there's assistance with the cost. However, the people who don't receive that assistance are undocumented children. And so there was concern because it's like $8,000 out of pocket for that medical examination. And so folks at the ADA's office were just like wondering like what could possibly be done, whether it's a conversation with Duke to ask them to waive those fees for the undocumented children who have to receive those medical exams, or if there's another entity that could do it. I think they said it's about 20 children a year maybe that go through that process that have that are undocumented.
So when you say the ADA's office, is that the district
assistant-
attorney's office?
or sorry, yeah, the district attorney's office. So it was the ADA who had reached out to me, who worked on
Okay.
some cases like this.
Yeah, typically those are handled in our office by the DSS attorneys because they deal with abuse and neglect cases, and so they would be the resource that you would need to tap into to understand how the process works. With regard to whether or not there can be a request for reimbursement, I really could not answer that. Okay. It would seem to me that if it is a part of an investigation and it has to be done, then there would be some mechanism for actually providing that particular service. Now, when you receive services at Duke, they always tell you that, you know, it may not be gratuitous. So in that regard, I don't know whether or not Duke is the exclusive venue for having that done. Perhaps some of the things can be done here at the health department. I don't know if that's potentially a conflict of interest. Maybe that's why they go to Duke. But the resource for that would be in our office with the attorneys that do abuse and neglect work, child abuse and neglect work. So if you would like, I can certainly make an introduction and you can talk to one of them about it, or I can talk to Al and have Al facilitate that as well. But that would be the resource you would need to determine how that process actually works.
That would be great. Thank you so much, Attorney Wardell.
All right, no problem.
Yeah.
Okay. Any other questions? All right. So we'll move on to the next item on the agenda, which is the Health Director's report. Director Jenkins, you have the floor, sir.
Really not much to report for the Health Director's report. Certainly willing to answer any questions you all may have, but for the most part, business as usual.
So I did have a question. I was looking over the report. I was looking at the update on the Fast Track Cities program, and the the statement of the goals for the program, the 95% of those living with HIV, knowing their status by 2030, 95% of all individuals living with HIV on a continuous antiretroviral therapy, and 95% of those with HIV achieving suppressed viral loads, all by 2030. I applaud those goals, but I was wondering if you or a staff member can tell us where we are with those metrics in 2023. Any knowledge of what percentage of the that population?
I know that I would not be able to give you those metrics off the top of my head, but I will say that Durham County has been doing extremely well. We're fortunate to have county commissioners that have invested in a position that really is geared toward ending the epidemic, and that is currently being held by Mr. Randy Rogers, who operates out of the Health Education and Community Transformation group. So what I would love to do, Mr. Chair, is maybe at another time, just give a nice program highlight for you all. Sure. To kind of bring back a lot of information, because it's ironic in that at the work session for the Board of County Commissioners, Vice Chair Jacobs just asked how we were doing with our Paris Accord and all that you just mentioned about the ending the epidemic. They wanted an update as well. So again, great minds think alike, I should say. So we're more than happy to provide that information at a later date. There certainly will be after April, because April is going to be totally dedicated to the budget.
Okay, very good, very good. All right. Does anyone else have any questions or comments regarding the director's report? All right, all right. We're moving along, folks. We are almost at the end of our agenda here. So we have no committee reports, no old business. We have one item of new business, or we have a couple of items of new business. The first being the budget amendment. We'll allow Director Jenkins to share that amendment with us.
Thank you, Mr. Chair, and again to the members of the board. We are seeking approval of a Delta Dental Foundation grant to the Department of Public Health Dental Division for $5,000. Not as much big money, Dr. Jackson, as we're used to, but again, $5,000, we'll take it. We're requested to approve accept this grant fund from Delta Dental Foundation, again, for the Public Health's Dental Division's Emerging Smiles Dental Assistant Program. While I have the mic, just let me give a quick shout out to Dr. McDougall for coming through a couple of weeks ago and visiting our dental operatory. The staff was delighted to have you visit, and we certainly hope this won't be your last visit.
Absolutely won't be the last, and I plan on getting by to see other departments and check in there as well and learn. And that's really the objective for my visit, the impetus for my visit. So, yep, thank you.
So, Director Jenkins, is this the local Delta Sigma Theta chapter?
No, ma'am. This is actually a group, a company that specializes in dental activities.
Oh, okay. Okay. Yeah, I got a little confused when you said Dr. Jackson is not. So I thought there was a Delta link, but I didn't really think so.
But we will take donations. You know, we will take.
Right. So, do we have a motion to accept the budget amendment, the $5,000 grant from Delta Dental Foundation to the Public Health Dental Division for $5,000 again?
So moved.
Seconded.
All right, it's been moved and properly seconded. We're ready for our vote.
Dr. McDougall?
Yes.
Dr. Ray?
Yes.
Commissioner Along? Dr. Jackson?
Yes.
Dr. Miller?
Yes.
Dr. Brightway?
Yes.
Mr. Brown?
Yes.
Mr. Gregorio?
Yes.
Thank you.
right, thank you. All right, moving on through. Do we have any agenda items for next meeting? I know Director Jenkins already shared with us that we're going to be heavy in the budget. Are there any specific parts of the budget that we need to make sure we have on the agenda? Director Jenkins.
I would just say we look forward to our finance administrator, Micah Gwendon, presenting a very comprehensive budget for this great board. We do have a number of new spending initiatives which may come as a surprise because since I've been the health director, we've not really asked for much. But again, we do have some needs that need to be addressed. But the budget is pretty much has been done, and we look forward to presenting it to this board.
Okay, very good, very good. Does anyone else have any agenda items for next week, next month that need to be that we need to make sure that we have on the agenda? Okay, all right. We're at the 11th item of a 12-item agenda. Any informal discussion? Any comments from the board members or staff members? All right, all right. Seeing or hearing none, I will entertain. I think this is a record. We might need to get
Best
someone
meeting ever.
to clarify. It's the shortest one, maybe, since I've been on the board at least.
Wait, I've got about 15 things. Let's all just start discussing.
There we go. Well, it's a little chilly, but it's still a beautiful day outside. So hopefully, if we get out of here early, and Commissioner Alam doesn't really have 15 more items, we'll get out there and enjoy the day. But I will entertain a motion now to adjourn.
Motion to adjourn.
Second.
All right, it's been moved and properly seconded. We're ready for a vote.
Sorry, I was muted. Dr. McDougall,
Yes.
Dr. Ray,
Yes.
Commissioner Alam,
Yes.
Dr. Jackson,
Yes.
Dr. Miller,
Yes.
Dr. Brightway,
Yes.
Mr. Brown,
Yes.
and Mr. Gregorio.
Yes.
Thank you.
Awesome. Well, thank you everyone for coming on board. Attorney Wardell, looks like you were about to make a comment.
I was just going to ask Rod to be on the lookout for a call. I need to call and talk to him about it quickly after we get off. That's all.
Okay.
I'll be right here.
Very good.
All right.
All right, folks, we'll get out there and enjoy your Thursday evening, and we'll see you next month.
Thank you.
Thank you so
Thanks,
much.
everybody.
Thank you.
Take care.
Take care, everyone.
Take care.